Greetings and welcome to your destination. You've reached the Psychological Wellness Hub. We aim to help you build your knowledge and wellness around better understanding mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What is psychotherapy treatment part 2? Who can treat you with psychotherapy? Let's do a quick review about psychotherapy. Psychotherapy is a form of talk treatment that focuses primarily on mental health, substance use disorders, other medical conditions, and many more. It's a journey of self-discovery and healing. Therapy involves you and your therapist working as a team. As the team works together to make connections with your problems so you can relate to those internal forces which keep the problems going. The team works together to look inside of you as well as outside of you with the intention to understand the inner and outer workings of how the problems live and breathe. You are the navigator and the therapist is a guide to help you understand and make use of your thoughts, feelings, and actions. This is an effort to identify the necessary changes for the positive and to promote healing. Psychotherapy treatment. Who can provide this treatment for you? Generally, any behavioral health or mental health provider whom has a couple of key items that grant them the ability to provide this treatment. They will generally have a master's degree, a doctoral degree, or a medical degree that focuses in some kind of behavioral science. Second, they will have advanced training as part of their degree that involves treatment training with live patients, clients, or consumers, which is supervised by someone with the full ability to provide the treatment. Third, they'll have passed an advanced exam that is chartered by a body or organization that regulates their respective profession. Finally, they have to obtain a license in their jurisdiction. Basically, this is usually issued by the state or district they want to practice in. What types of providers should I be looking for who provide psychotherapy treatment? As of this date, or 2025, the majority of these mentioned are applicable to the United States and several other countries such as Canada, the UK, Ireland, Australia, New Zealand, and more. This is based on some research and guidance from colleagues I have abroad. The first type of provider is a psychiatrist. Psychiatrists not only prescribe behavioral health or mental health medications, but some of them are also trained and licensed to practice psychotherapy treatment. Generally, they have an MD credential or a DO credential that specifies the training in psychiatry. MD meaning medical doctor or DO, doctorate of osteopathy. Now, there is a trend that's happening in psychiatry where more and more they're being used as prescribers than psychotherapy providers. The next on the list is clinical social workers. These are advanced trained and licensed clinical social workers who have earned the privileges to diagnose and treat behavioral health conditions through psychotherapy treatment. They may also do things like some basic psychological testing. They generally have credentials such as the LCSW, the LICSW, the LISCSW, LMSW, and more. The next on the list is licensed psychologists. Psychologists have advanced training. Licensed psychologists whom have earned privileges to diagnose and treat behavioral health conditions through psychotherapy treatment. They generally will do more advanced psychological testing. They generally have credentials such as PsyD or PhD. Mental health counselors. These are advanced trained and licensed mental health counselors who have earned privileges to diagnose and treat behavioral health conditions through psychotherapy treatment. They may also do things like some basic psychological testing. They generally have credentials such as LPC or LMHC. Marriage and family therapists. Generally, they have similar trainings, licenses, and privileges as above. They will generally provide specialty psychotherapy treatment that is focused on couples or married individuals. However, all the previously mentioned providers can also provide specialty psychotherapy treatment that is focused on couples or married individuals. Psychiatric nurse practitioner. Not all psychiatric nurse practitioners can provide psychotherapy. Generally, this is going to be based on education, advanced training, and licensing districts. Often, certain master degrees for nurse practitioners like the CNS or clinical nurse specialist will offer this additional ability to practice. In districts or countries outside the United States, in some cases, certain countries allow a bachelor's level registered nurse to perform psychotherapy with some advanced training. There's also a select few disciplines inside the U.S. and other countries who can provide this intervention, but it is beyond the scope of this video. Feel free to check out the channel and watch more videos on this topic and how you can make the best use of psychotherapy. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below more about or what topics could be useful to you. If you like what you heard today and would like to hear more from Destination Psychological Wellness Hub, please consider liking and subscribing to the channel. Look for that subscribe button just below the screen and that thumbs up button. Go ahead and click both of them. This will help you get the newest content produced by the channel to you. Please tell all your friends and family about the channel and share this and other videos with them on the channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.